Aloha, welcome back to General Pharmacology. We'll move to PowerPoint slides and get started with even more medical terminology if we haven't had enough already. Usually I cover math first, and maybe I will cover math first again, but we decided to cover terminology first. I started working on the slides, and then I walk in the door, and then I'm ready to give this presentation. I think, oh, well, this is supposed to be next time. So we're covering even more medical terminology today, and then after this will be the math part. So let's move forward. All right, now we're at the part of root words. Before we covered prefixes and abbreviations and suffixes, and here we're covering root words. And again, I want to remind you, especially the beginning of last lecture, about how in medicine we use things nominally. We'll give things a name because it might make sense, but that name is not exactly defining for the medical condition. And so a perfect example is like the word essential. Normally, essential means something that we need. And yet there's something out there called essential hypertension, and essentially it's called that because essentially they're not sure what the cause of essential hypertension is. So be very careful with the medical terminology, because what we say something means isn't necessarily how it's always used. Another great word is malignant. When we use the word malignant, we are usually always talking about cancer. And as we go through this, we'll see the word malignant has to do with cancer. And yet there's this thing called malignant hypertension that has nothing to do with cancer, because in reality the word malignant means destructive to organs. And that can be cancer as well as some other things. So again, be careful with words. Just because it's the word malignant doesn't always mean cancer. And that's especially the case in something like malignant hypertension, which has nothing to do with cancer. That being said, let's continue with more medical terminology. So when we come across the word abdomen or abdomino, they're referring to the abdomen. Adeno refers to glands, and so we'll hear about adenomas, adenocarcinomas. Adenocarcinomas are cancers that will begin in certain types of glands. Adipo has to do with fat, so adipose tissue refers to cells where we store fat. When a baby is gestating, it floats around in a little fluid-filled sac, and that fluid is called amnion. And so when we talk about amnio, we're referring to that fluid sac. And so maybe you've heard of an amniocentesis. That's when they take a needle and put it in the amniotic sac to draw fluid so they can analyze the fluid. Andro means different things depending on the context. Sometimes it will mean adult. And so androgynous, androgenous, andro as an adult, genus as into form. When we talk about androgynous hormones, we're talking about hormones that cause the child to develop into an adult. Sometimes androgynous, androgenous, will refer to things and hormones about developing males. And then in TV land, the word androgynous doesn't mean anything that I've mentioned so far. So again, this is one of those words we have to be careful of. Andro can refer to an adult. Andro can refer to a male. And then andro can refer to none of the above. Angio, here it says vessel, and we think of blood vessel, but angio can be any kind of tube as well. And so we'll see words where angio refers to a blood vessel, but angio can refer to any kind of hollow tube. And as we go through this, it's going to be impossible for me to remember all of the strange exceptions to the root words. So maybe the next slide will be helpful. And I'll tell you this now, when you're taking the quizzes on LAULIMA, I don't have time to program LAULIMA to take every one of these examples. So when you do these quizzes on LALIMA, the purpose is to teach you, because how LALIMA scores doesn't matter, because I will sit down and look at those scores eventually and see if your medical terminology is perfect, because of course that's our expectation in here. The LALIMA quizzes are drawn from a large set of pools, and if you take the terminology quizzes over and over again, then you'll see all of these, and I want to make sure that you have a really good command of this information, because some of the information that's coming back to me about people who are taking this class is they're having a problem with medical terminology. Therefore, don't be one of those people that has a problem with medical terminology. All right, that being said, abdomino is abdomen. I think we've covered that. Aqua is water in Spanish. Agua is watery in our medical terminology. Arterio refers to an artery. Large arteries are arteries, and smaller arteries are arterioles. And so when we see something that's arteriole or arteriolo, we're usually referring to very small arteries. And so know the difference between arterio, which is an artery, and arteriolo, which is an arteriole, which is just quite simply a small artery. And the difference between an artery and an arteriole is an interesting read, and I'm going to let you guys chase that in an anatomy book. Arthro refers to joints, so an arthroplasty would be a joint repair. Arthritis is inflammation of the joints. Arthrocentesis is taking a needle and drawing fluid out of the joint. Athero means gunk in Greek. This gunky, greasy stuff is what athero means. Here it says fat, a fatty plaque. So when we talk about atherosclerosis, those are the fatty, scarring changes that occur inside of the artery. And you look at it, it looks like this gunky buildup. It's the cause of a lot of problems, myocardial infarction and stroke, generally due to atherosclerosis and their sequelae. Audio means hearing or sound. If you're an audiophile, you're somebody who's very particular about the things that you hear. RO means ear. And we talked about the abbreviation A. AS is left, AD is right, AU is both ears. Bili refers to the biliary system. Your liver not only processes the blood, blood goes in and blood comes out of the liver, but something else that comes out of the liver is bile, and that bile drains into the small bowel. And when we're talking about that, we'll talk about biliary, and that refers to the vessels that carry bile from the liver through the common bile duct and into the small bowel. Blepharo refers to eyelids when we have someone who is having unwanted effects from maybe antipsychotic medications. Maybe they will have blepharospasm, and that's just spasming of the eyelids. Blepharitis is inflammation or infection of the eyelids. Blepharoplasty is repairing the eyelids. Broncho refers to the bronchus. You have a trachea, and it goes down into your chest, and then when it splits into its bronchi. And as things get smaller, we call them bronchioles. So broncho refers to the bronchus or the bronchi, and bronchiolo refers to the smaller bronchi. Bronchus singular, bronchi plural. Bucco means cheek in this situation, and so when we talk about a buccal delivery system, some medications can be put in the cheek for delivery, and that'll be called a buccal delivery. Bursa refers to a bursa, which is a type of fluid-filled sac in the joint. You can scratch out bursa. Matter of fact, I'm going to scratch it out just so we can fix this next time I ever do that, if there is a next time. The bursa of a joint. Well, the bursas are little fluid-filled sacs that provide lubrication for the joint. They'll get squished and they'll swell up. We'll call that bursitis. Sometimes we'll have to drain those with fluid, although that's not always a great option. But when we're referring to a bursa, that refers to what's called a bursa of a joint. You don't know what a bursa is? It's an outgrowing of the joint and the tendons, and it's just this little fluid-filled sac that helps provide lubrication at very high leverage points for the tendons. Calca refers to calcium. Capnia has to do with carbon dioxide. And so when we refer to hyper-high capnia, that means a buildup of carbon dioxide. So maybe somebody has dyspnea, and dyspnea means that they feel like they're short of breath. Something wrong with pnea, breathing. Dyspnea just quite simply refers to the perception of being short of breath. And so if we have a person who has dyspnea and they are hypercapnic, that means their carbon dioxide levels are going up. Capnia, carbon dioxide. Carcino refers to cancer. Carcinomas are cancers that start on surface body areas, and that's body areas that separate the body from the outside world. So that will include the lungs. Even though we breathe in and we think of our lungs as being on the inside, think about it, our lungs carry air from the outside and then push the air back out. And so our lungs are a lining of our body. And so any cancer that begins with a lining that separates the inside from the outside world, those cancers are called carcinomas. You'll hear anything that can start any kind of cancer called a carcinogen, gen as in Genesis, from the beginning. Cardio means heart. Carpo refers to our wrist bones. The wrist bones, they're right here, and those are our carpal bones. Cephalo pertains to the head. We'll come across that word again. Cerebro has to do with the cerebrum. The large part of your brain is the cerebrum. And so when we say things like cerebrospinal, that means from the cerebrum to the spinal cord. In neuroscience, they've made this somewhat simple. The tracks are named from O to. You can put that in your little root words. In neuro, something will be from, O, and then to. So cerebrospinal will come from the cerebrum and go to the spinal cord. But spinocerebral comes from the spinal cord to the cerebrum. And so whatever's listed first is where the tracks are coming from, and then the little letter O. And then where those tracks are heading, that's the second part of a word. That's at least in neurology. All right, well, we talked about biliary, referring to bile and gall. And that bile is made up a lot of variations of a cholesterol salt. Those cholesterol salts will be referred to chole as well. And so chole, you can see, will refer to the gallbladder. It can refer to the bile and the gall as well. That green fluid that's bile, it's the same thing as gall. All right, so here is a great example of angio. We think of angio being a blood vessel, but actually angio can be anything. And here, cholangio refers to a vessel, but there's not blood in that vessel. There's bile in that vessel. Right, so again, be careful with these words. Angio means blood vessel. Yeah, about 99% of the time, but every once in a while you come across a word like this, chole, bile, angio, that's the bile duct. So if we do a cholangiogram during gallbladder surgery, we'll open up the common bile duct, put a catheter in, shoot some dye, look at it under the fluoroscope and see does the bile, or I'm sorry, does the imaging dye flow into the liver, or is there some kind of obstruction higher up? And so we will do a cholangiogram to look and see if our bile duct is communicating with the bile ducts in the liver, or if there's some kind of stony obstruction or a mass or dilatation. And so cholecysto will refer to the gallbladder. Cysto, cystic, as in an open space. And so you'll hear that cysto word used to not only describe the bladder that holds urine, but the bladder that holds gall as well. So be careful with that cysto word. Chondro is cartilage. And so you'll see people, maybe they have achondroplasia. And that means their cartilage and the soft parts of their joints don't form properly. A without chondro, cartilage, plasia, as in proper growth. To coagulate means to clot, and so coagulo refers to blood clotting. The cochlea refers to the ear. Colo, as in colon, as in your large bowel. So if somebody has a colonoscopy, they're getting a scope placed into their colon to look for masses and neoplasms. The outer lining of your eye is your conjunctiva, and so when you have conjunctivitis, you have an infection of the outer mucous membrane of your eye, and so that's what pink eye is. You'll hear pink eye called conjunctivitis. All right, corono means crown. Corona means crown, and there's all sorts of crown words that refer to corono. And so if we take the heart and we strip away all the muscle, and we're left with this cartilaginous ring with these valves that point up. And so if you take all the muscle away from the heart and you're just left with the cartilaginous structures in the valves, it looks like a crown. And that's where that word comes from. That's why coronary, refers to heart, because the cartilaginous structure in the valves look like a crown. I have a good picture of that somewhere. Maybe we'll find it. And so those blood vessels that go around that ring structure, because the valves lie in a plane here. The valves lie in a single plane, and they look like a crown, and that artery that goes around that plane, that's where that word coronary artery comes from. But corneo refers to the cornea of your eye, and the cornea is the large fluid-filled sac that's where the light comes in. Costo refers to ribs. So costochondritis is an inflammatory pain problem with where your ribs and your cartilage meet each other. Cranio refers to the cranium, the skull. So craniotomy is opening the skull to do brain surgery. Cryo means cold. So if you have a wart or some kind of skin lesion and they want to put liquid nitrogen on it to freeze it, they'll call that cryotherapy. Cryo meaning cold. Cuto or cuta, like cuticle, refers to skin. Cutaneous refers to skin. There's that cutaneo word. So subcutaneous means under the skin. Cyano refers to the color blue in this situation, and so if somebody is cyanotic, they turn blue. And so when we look at a patient and they don't have a good pink color, and this is something that you can see across the room when somebody is getting hypercapnic, a buildup of carbon dioxide. When the carbon dioxide comes in contact with the hemoglobin turns into its iron state that is blue, and we refer to that as cyanotic. And so look for signs of cyanosis for people in your waiting room. That's one of the first things I do is I'm triaging a large room full of people. I remember the words of wisdom that our pulmonologist and intensivist gave to us at the beginning of every lecture, and that's pink is good, blue is bad. And so if somebody's pink, they're probably properly oxygenated. If they're blue, they're not properly oxygenated. And so if somebody does not have a nice healthy pink color and they tend to lean towards the blue color, we refer to that as cyanotic. Don't confuse that with cyanide. Cyanide eventually turns us blue, but cyanide, by blocking electron transport, the first thing that something happens when somebody has cyanide poison is turn bright red. And so be careful with the word cyano. But cyanotic means blue color due to hypercapnia. All right, a cysto can mean any kind of bladder, any kind of empty space. And so a cystoscopy usually refers to taking a camera and looking at a bladder. And so if somebody has hematuria, blood in their urine, we might want to do a cystoscopy, take a look inside of their bladder to see if there is some cancerous reason or some other life-threatening reason for hematuria. But cysto can actually mean any kind of empty space. And so be careful with that word cysto. It can refer to the gallbladder, it can refer to the bladder, it can refer to any of those empty spaces. All right, cyto means cell. Leukocytes are white blood cells. Erythrocytes are red blood cells. Cytoplasm is the liquid inside of the cell. Right? Cytopenia is too few cells. And so we'll talk about pancytopenia with bone marrow suppression. Pan, everything. Cytocellpenia, too few. And so sometimes we'll use cancer chemotherapeutic agents that suppress the bone marrow. And one way to say that is, oh, it causes bone marrow suppression. And the way we see that bone marrow suppression is through pancytopenia. Dacro refers to tears. I don't have any good examples of that. Dent, as in dental, refers to the teeth. Dermato refers to the skin, so like a dermatologist is a skin doctor. Dipso refers to not only drinking, but thirsting as well. And so if somebody has polydipsia, that means they're very thirsty and tend to drink too much. And a usual reason for that is diabetes mellitus and diabetes insipidus as well. Diabetes mellitus is the disorder of glucose regulation. Diabetes insipidus is a disorder of water regulation. So again, be careful of words like diabetes. When we talk about diabetes, we're always talking about disorders of glucose regulation, and that's fine, but there's another diabetes out there called diabetes insipidus, and diabetes insipidus has nothing to do with a disorder of glucose regulation. And so diabetes mellitus, mellitus means sweet like honey because that's how they used to figure that out in the old days. Diabetes insipidus has to do with water regulation. However, they got their names because back then they did not know the difference between diabetes mellitus, the disorder of glucose regulation, and diabetes insipidus, a disorder of water regulation. But they were both characterized by polydipsia, where they were thirsty and they drank a lot, and polyuria because they were losing urine. And so in diabetes mellitus, people lose urine because glucose is an osmotic diuretic. In people with diabetes insipidus, they lose water because either the brain is not making antidiuretic hormone or the kidneys are not sensing antidiuretic hormone. And both of those conditions resulted in polyuria and polydipsia. And so that's why there's different types of diabetes out there, because the word diabetes came from polydipsia and polyuria. Duodenal refers to the duodenum. Dura, dura as in durable, mater as in mother. The word mother comes from swaddling clothes. When you have a baby and you want to protect the baby, then you wrap it and you put something soft against the baby's skin, and then after the kid is swaddled in something soft, then you can put something hard like canvas around the child, or a fur or something like that, animal skin, to protect them on the outside. And so dura, durable, mother, came from swaddling a baby, and the outside part was the tough part. Dura as in durable. So that tougher outer lining of the brain is called the dura mater. And then the soft part's called the pia mater. And I raise triplets, so I know a little bit about kids. All right, electro refers to electricity. Embryo refers to an embryo, a developing baby in between weeks, 4 and 9 are the embryonic period. Encephalo refers to the head, so encephalo refers to the brain as well. When we talk about entero, as in entering, we're talking about the gastrointestinal tract, and even the exit of the system is still called the entero. And so when we're talking about entero, we're talking about the gastrointestinal tract, from the lips to the end. So you'll hear about medications that are parenteral, par as in outside of, entero as in the gastrointestinal tract. So anything that is a parenteral medication, that just means it's not used in the gastrointestinal tract. Eosin is a red dye, and so eosin refers to red, and so little white blood cells that will take up this red stain will be called eosinophils. Fill as in to like or take something in, eosin as in red, as in the red dye. And so eosinophils are white blood cells that are red when they are stained with the right Giemsa stain. Is it right Giemsa? Anyway, eosin is the red dye. Apesi refers to the vulva, the superior part of a vagina, and so episiotomy is repairing that part. After childbirth, the vagina can tear, and so an episiotomy is a repairing of that. Actually, the episiotomy is opening it, and then repairing it is all part of the episiotomy. Again, erythro means red as well. Eosin meant red. Yeah, so does erythro. An erythrocyte is a red blood cell. Esophago refers to the esophagus. Fascio refers to fascia. In any kind of living creature, as you go through the creature, you'll notice that there are different layers, like the layer of a skin. Think about a chicken. When the skin comes off, that's a separate layer of fascia. And so all these different muscles and different parts, they're all separated from each other. And the way they're separated from each other is something that we call fascia. And so fascia is something interesting to read about because it's very difficult to define until you understand what that means. And so sometimes we'll do something called a fasciotomy. If somebody has a severe burn on their extremities or their legs, that burn will cause swelling in the tissues, in the arms or the legs, so much that it compresses the blood vessels and will cause ischemia of the blood vessels, an infarction because of this compression. And the muscles are being compressed because there's this outer lining of the muscles that compress it. And it's a type of fascia that goes around the muscles. And so if somebody has a severe burn and the swelling is going to shut off the blood supply to the arm, then we will we'll open the fascia around the muscles so the muscles can expand out of their space so that they don't have to compress on the blood vessel. And that's called a fasciotomy. And so if you work with intensive care with people with burns, do not hesitate to get somebody in and do a fasciotomy if you believe that their burns and their swelling are interfering with the blood supply of their arms or legs. All right, again, feto is a fetus, and the gestating baby is a fetus. And we just talked about that. Fibulo refers to the fibula, and that's the little bone in your lower leg. The fundus is the part of a hollow organ that's furthest from its opening. And so the fundus of it, the heart, is right there because that's the part that's furthest away from the opening. The uterus has a cervix on one end, and on the other end, the furthest away from the opening is its fundus. And so if you do prenatal care, as the baby develops, maybe you'll measure her fundus and measure the length of the space between the pubic bone and the fundus, and you'll get this fundal length, and you can see how, if the baby is developing properly, using a lot of different data collection, but that as well. So again, the fundus is the part of a hollow organ furthest from its opening. It can refer to the uterus, it can refer to the heart as well, or any hollow organ. Gastro refers to the stomach. Gingivo refers to the gums. Gingivitis is an inflammation of the gums due to lack of cleaning and toothbrushing. Glauco refers to a gray or silver color. And so with glaucoma, well, you know what, we're going to talk about glaucoma when we get to hypertension. I don't want to talk about that now. Glio, as in glia, these are glial cells. These are fat cells that insulate neurons. And so one way that neurons can improve transmission and saltatory conduction is to have glial cells that insulate them. And so a very severe type of cancer is a glioma or a glioblastoma. Glomerulo refers to the glomerulus of a kidney. The glomerulus is the functional filtering unit of the kidney, and the kidney is made up of millions of glomeruli, independent glomeruli. And so glomerulosclerosis refers to scarring of those glomeruli. Glosso refers to tongue. Sometimes you'll hear somebody who speaks multiple language referred to as polyglossal because they speak many languages. Medical things that have to do with the tongue will be referred to as glosso, and I can't think of any glosso words right now. I have another set of slides, maybe that'll help. All right, gluco, as in glucose, as in sugar. Same thing with glyco. Notice there's just a small change in spelling between those two words. They mean the same thing. So hyperglycemia is sugar too high, glucose too high. Hypoglycemia, hypo-low glycemia is glucose sugar too low. Anything that refers to gonado refers to the gonads, and that refers to ovaries and testes as well. Those are the gonads. As the baby develops, They start out with pre-ovaries, and if they turn out to be female, those ovaries will stay in place. If they start being, if the baby starts being subjected to male androgens like testosterone, then the ovaries will change and develop into testes. And so those are all the gonads. Gravida refers to pregnancy, and so you'll refer a prima gravida. If you are an OB-GYN, you'll have a patient and that'll be their first pregnancy, and we'll call that a primigravida, or we'll refer to that person as a primigravida, their first pregnancy. Gyneco, those terms refer to women, like gynecology is a physician who specializes in issues of women reproductive issues. Hemo as in hemoglobin, hemato as in blood. So a hematocrit, crit means to separate. A hematocrit is a blood test that we allow after properly anticoagulating the blood. We let the blood cells settle out after an hour or two, depending on whose lab you're in. And the hematocrit tells us how much of the blood is percentage of cells and what percentage is the fluid, the hematocrit. All right, hemangio. Remember, angio can be any blood vessel, but hemangio refers to a blood vessel. Hepatic refers to the liver, and so we'll talk about hepatitis A, hepatitis B, hepatitis C, hepatitis D. Hopefully we won't talk about E and F. All those refer to inflammatory, infectious conditions of the liver. Hepatitis A is passed around by the oral fecal route, meaning that we get it by eating something and pass it along by pooping it. But hepatitis B and C, those are blood-borne pathogens that we need to be aware of when we're doing things like phlebotomy and anything else that has to do with blood-borne pathogens. Hepatitis B and hepatitis C are the blood-borne pathogens. Hepatitis A is not. Hydro refers to sweat, and so if hydro refers to sweat, and I think I have another set of slides for that. Humero refers to the humerus. The humerus is a bone in your arm. Humerus, radius, ulna. We'll do that right now. Hydro refers to not only water, but can refer to fluid as well. And then sometimes, if we're in the chemistry business, hydro is going to start referring to hydrogen. So be real careful about that hydro word. But hydrated means to get fluid back into the body. Hystero, as in hysterectomy. Hystero is uterus. Hysterectomy is surgical removal of the uterus. Ilio refers to the ileum. That's the middle part of the small bowel. Immuno refers to the immune system. We'll talk about the immune system. That is the part of your body that fights with infectious organisms, foreign substances. ISO is an interesting word. ISO means the same, or ISO means equal. Isosceles triangle means their sides are equal, meaning their angles are equal. Jejunal is a part of your small bowel as well. Let's see. Jejunum ileum cecum. I think that's right. Kinesio, as in kinetic, refers to movement. Your lacrimal glands make tears. Lacrimal refers to tears. Lacto, as in lactose sugar, is the sugar found in milk. So lacto, as in lactate, means to make milk. Laparo has to do with the abdominal wall, and so when we do a laparoscopy, we're putting a camera across the abdominal wall so we can see inside of the abdomen. A laparotomy is to open the abdominal wall and do surgery. Laryngio laryngo, I'm sorry. Laryngo refers to the larynx. Ligament refers to ligaments. Lingua also refers to tongue. You'll hear somebody called a polylingual, referring to their ability to speak different languages. And so glossal, lingual refer to the tongue. Lipo, again, is fat. Litho refers to stones. And so lithotripsy, tripsy to break, litho, stones. If we have noun. All right, so litho refers to stones. Lumbo refers to the lower back, the lumbar region. Lympho, as in lymphocytes. Mammo, as in mammograms, gram to take a picture of, mammo, meaning breast. But that masta can also mean breast as well. Mammo, as in mammal, that's what I'm looking for. A mastectomy is a surgical removal of the breast. Melano refers to melanin, which has a brown-black color. And so a melanocyte is the little cells, little skin cells that make the black color. All right, so these are the carpal bones. So the metacarpal bones, the metacarpal bones are right above those, or distal to the carpal bones. The tarsal bones are the small bones in your foot that are the equivalent of the carpals. And so the next set of bones distal to those are the metatarsal bones. Morpho means shape, so its shape or its size, and so we'll talk about its form or its shape. And so as a cell develops and differentiates, those different stages, they'll have different morphology. And so morphology will be used when we talk about cancer cells. We'll get a biopsy, we'll look at those under the microscope, and we'll look at the morphology of the cancer cells, see what their shape is, see what their cytoplasm looks like, see what their nuclei look like, how quickly are they reproducing those signs. That's morphology. Muco refers to mucus. Myo refers to muscles. Myco refers to fungus. Antimycotic agents will be antifungal agents. That's another word for antifungals, antimycotic. If somebody has mycosis, they have a fungal infection. The eardrum is referred to as maringo, and you might hear of different maringocentesis if they take a needle and put it in the eardrum for very rare circumstances. Narco means to sleep, so technically something that causes narcosis causes them to sleep. But that doesn't mean that's how the word narcotic is used outside of medical terminology or pharmacology class. Naso refers to the nose. The natal period is the birthing or delivery period. So prenatal is before birth, perinatal is around the time of birth, and postnatal is after the delivery. Nephro refers to the kidneys. Remember, glomerulo refers to the kidneys as well, but the individual parts are the glomerulus, the glomeruli. The entire kidney is nephro. So a nephrologist is a kidney specialist. A nephrectomy is a kidney removal. Neuro refers to neurology, neurons, nerves. We'll get plenty of neuro words in this class. Nocto, as in nocturnal, refers to nighttime. Oculo, as in ophthalmic, ophtho, refers to the eye. Something I want you to see about spelling is sometimes you'll see opto spelled without a P or without an H, and then sometimes you'll see ophthal spelled with an OPH. Technically, oph as a prefix is spelled OPHTH, And so this is actually this correct spelling of that prefix for eyes. We'll see opto occasionally, like optokinetic eye movement. However, when you're spelling ophthalmologist and ophthalmic solutions, make sure that's spelled O-P-H, not O-P-T, because some of us know how to spell a little bit. Onycho has to do with the nails, not only the fingernails, but the toenails as well. So onychomycosis, mycosis being a fungal infection, onycho has to do with the fingernails or the toenails, and so fungal infection of the toenails, you'll hear called onychomycosis, and that can refer to fungal infections of the fingernails as well. The ovaries can also be referred to as oophoro. So an oophorectomy is a removal of the ovaries, a surgical removal of the ovaries. Ophtho or opto, again, is eye. Oro means mouth. Perioral, as in oral, is around the mouth. Perioral is around the mouth. Orcho can refer to the testes as well, and so when somebody undergoes an orchiectomy, now that is surgical removal of the testes for whatever reason. Ortho means straight, and so an orthopedic surgeon is someone who makes bones straight. And so in chemistry, we'll see ortho referred to as straight. In medicine, ortho, the ortho guy, is usually the orthopedic surgeon. But keep in mind that the person who makes our teeth straight is the orthodontist. And so ortho doesn't necessarily refer to an orthopedic surgeon. Ortho can just mean straight. Straightening of the bone, orthopedic surgeon. Straightening of the teeth, orthodontist. Osteo refers to bone. Osteocytes are the cells that make bone, and osteocytes are the ones that are involved in bone metabolism, and we'll talk about those when we talk about bone metabolism. Odo or otio can also refer to the ears. Ovario, that makes sense, that's ovaries. Oxy has to do with oxygen. Leo Rohr's Ger, loss of electrons is oxidation. Pachy means thick. A pachyderm is an elephant because of their thick skin. Pancreatic refers to the pancreas. The pancreas is an organ sitting behind the stomach that is involved in not only digestion, but glucose regulation and a few other things as well. Parto, as in parturition, is childbirth. Patella is your kneecap. Your kneecap is a sesamoid bone that is between your quadriceps and the insertion into your leg bone. Pectoro refers to chest. Ped, as in pediatrics, refers to children. Pelva refers to the pelvis. The pelvis is the place below the abdomen. Perineo is the perineum. The perineum is the triangle that's formed by the opening at the base of the pelvis, and peritoneum, peroneal, peritoneum. The peritoneal lining is the peritoneum. I knew I'd go through this. Oh, the peritoneum is retroperitoneum. The peritoneum is the lining of the abdomen, and so if something's behind the lining of the abdomen, then that's retroperitoneum. All right, so again, perineum is in the base of the pelvis, where the rectum and the triangle formed between the rectum and the pubic bones. That's the perineal area. The peritoneum is the lining of the abdomen, and that's different than peroneal. So if you know the difference between peroneal, perineo, and peritoneo, then you'll be able to give this lecture. Phago means to eat. A phagocyte is a white blood cell that eats other cells, a cell that eats other cells and junk. Phalangio, your phalanxes are your fingers. And so phalangio refers to not only the fingers, but the distal phalanxes of the toes are phalangios as well. However, in this case, phalangio usually refers to fingers. Pharyngeo has to do with pharynx, the back of your throat, the lower part of your throat, and so pharyngitis has to do with inflammation and infection of the pharynx. Phlebo has to do with veins, so a phlebotomist is someone who draws blood from a vein. A photo, as in photon, is light. A photograph refers to light. Phreno has to do with the diaphragm. The diaphragm is the muscle that separates the thorax from the abdomen, and contracting that diaphragm is what expands the volume in the thorax, causing the lungs to expand and air to come in. And so we'll hear about phrenic nerves that are involved in the diaphragm. And so phreno refers to diaphragm. Pylo means hair. And so trying to think of a good example of pylo, but one escapes me. I think maybe the next slides will help me. Pneumo, like a pneumatic wrench, is a pneumatic power tool, is run by compressed air. Pneumo refers to the lungs, or it can refer to air. Pneumonia is a lung process where there's fluid in the lungs. All right. Podo, as in podiatry, podiatrist is a foot doctor. We refer to pedi as a child in medicine, like pediatrics, but remember, a pedestrian is on foot, so occasionally that pedi word will refer to foot as well, so be careful. Maybe we should call them, rather than pedestrians, we should call them podestrians. Procto refers to the rectum, so a proctologist is somebody who is a doctor of those sorts of problems. Psycho, as in psychology, refers to the mind. Pubo, as in the pubic bone, that is the bone just above the reproductive organs. Pulmono, as in pulmonary, refers to the lungs. Pyo refers to purulent. You might know this as pus. Pyo refers to purulence. Pyro is going to refer to anything that causes a temperature. Pyro is not in here. And so something that's pyro, you can put P-Y-R. I think that's in our prefixes. Pyro means to cause a temperature. And so if there's some kind of process that's causing pyrogenicity, it's a pyrogen. That means it raises blood pressure. Pyelo refers to the pelvis of the kidneys. And so if somebody has pyelonephritis, that means the infection has gone all the way up into their kidneys, into the pelvis of the kidneys, and into the kidneys themselves. Quadra refers to four. Radio is the radius. That's the arm bone connected to your thumb. Recto also refers to rectum. I thought we did this already. There we go. Yeah, I did that already. Good. Renal, kidneys, retina, the back of the eyes. Rhabdomyo. All right. This is referring to skeletal muscle. Rhabdomyolysis is when someone undergoes a crushing muscle injury, and the contents, the junk, once the broken down muscle enters the blood, it starts to clog the kidneys up. That's what rhabdo is, rhabdomyolytis. It's when a skeletal injury is so crushing that it causes kidney failure. So be on the lookout for that rhabdomyo word. Rheum has to deal with a watery discharge. Rhino, like rhinitis is a cold. Rhino has to do with the nose. So rhinorrhea has to do with the watery discharge that comes from the nose. Salpingo has to do with the fallopian tubes, and so if we're doing a type of imaging to see if our fallopian tubes are open, we'll do a salpingogram. Sarco has to do with flesh. We'll see sarcomas arise from places that are not the body's surface area, a type of cancer that refers to areas that are not due to the surface areas. Remember, carcinomas come from cancers that cover the body surface, come from cancers from surface areas of the body separating the outside and the inside world. Sarcomas refer to internal structures that don't separate the internal and outside world. I think we'll cover that plenty in cancer and chemotherapy. Semino has to do with semen. Septa has to do with bacteria, kind of. Septicemia. Sepsis is really the body's response to bacteria, but an antiseptic is something that kills bacteria. Sialo has to do with saliva. Sometimes people will get stones in their parotid glands, causing them to swell up. And if we want to see that stone, if we're not able to deal with that stone, we can do a sialogram to put a little dye in the back of the mouth and run that up to the parotid to see if there's a stone blocking it. Sinuso refers to the sinuses. In your world, the sinuses are these little open spaces right here. You have these open spaces in here. These are maxillary sinuses, and you have these open spaces up in here, and they are called the frontal sinuses. And when you get these full of mucus and inflamed and angry and they get infected, we call that sinusitis. And so you think of these as your sinuses. But a sinus is any kind of opening. That's why when we talk about the heart, in the right atrium is a little sinus. It looks like a little cave that you could fit a pinky in. And it's just called a sinus. It's a little empty place. And that's where sinus rhythm of the heart comes from. Sinus rhythm of the heart doesn't come from your sinuses. The sinus rhythm of the heart comes from the fact that the pacing system starts in a little place right next to a little tiny hole, a little cave-looking thing. It's impressive when you see it in mammalian anatomy. This little place where it looks like you could fit the end of your pinky, and that little sinus is where the sinoatrial node is that paces the heart. Somato refers to the body of anything. Spermato refers to sperm. Sphero as in a sphere, meaning round. And so sometimes a red blood cell should look like a little donut, biconcave. There should be concavities on either side of the cell normally. However, sometimes the cells are not being properly made for whatever disease or nutritional reason, and we'll make spherocytes. Spheros and round, perfectly round spherocytes. And so a spherocyte and his erythrocyte, rather than being this little biconcave donut, is this little round sphere. A sphygmo means pulse. Maybe if you're old school enough, you'd know that something that measures blood pressure is called a sphygmomanometer. Manometry, measuring the pressure, sphygmo of the pulse. Right? So a blood pressure cuff is a sphygmomanometer. Say that. Spiro means to breathe, and so spirometry is a breathing test. If you send somebody to a pulmonary specialist, they'll have them blow in and out of a machine. Sometimes we can have spirometry through a little device, and what this is just seeing the different characteristics of our breath. Obviously, the more complex the spirometry, the more complex the device and the more information they collect. But spirometry, when we talk about a pulmonary function test, we're talking about spirometry, and so those terms will be used interchangeably. Spleno refers to the spleen. The spleen sits on your, okay, there's your left side and back up against the ribs. We'll talk about the spleen. When we refer to spondylo, we're referring to the vertebra, the vertebral column. So spondylitis is inflammation of the vertebral column. I'm trying to remember the last time I used a spondylo word. Spondylitis. We'll come back to that. Stetho, as in a stethoscope, refers to chest. Stoma refers to any kind of opening. That can refer to the mouth as well. However, when we talked about an organ having a fundus on the opposite end of its opening, if one end is the fundus, then the other end is the stoma, the opening. And so here, my good friends have referred to stoma as mouth, but stoma is any kind of opening. And so if you see somebody who has part of their bowel removed and we bring part of that bowel outside, we'll refer to that opening as a stoma. And maybe you'll be a nurse who's involved in stoma care. Synovium is the fluid in the joints, and so synovia refers to that fluid in the joints. The tarsal bones are your ankle bones. There's a big bone in your ankle, and they're called the tarsal bones. All your ankle bones are the tarsal bones. Teno, it refers to your tendons. Tenosynovitis is a form of inflammation of the tendons. Again, testiculo refers to the testes. Thorax is the chest. Thrombus is a blood clot. So when we talk about thrombo, we're talking about blood clotting. So a platelet is referred to as a thrombocyte, a blood clotting cell. So if they have thrombocytopenia, they have too few platelets. And so again, thrombo, as in thrombus, can refer to a blood clot, but thrombocytopenia refers to too few platelets. Thyro refers to the thyroid gland. So if somebody has thyromegaly, they have an enlarged thyroid gland, a large thyroid gland. Tracheo refers to the trachea. Your trachea goes down into your chest and divides into the main bronchi, and so tracheo refers to the trachea. A timpani is a big type of drum. The big kettle drums that they play in the orchestra, those are called timpani. And so that's where the word eardrum comes from. Timpano means drum, big drum. Urethra has to do with the urethra. This is the tube that separates your bladder from the outside world and allows the bladder to drain. And so that's the urethra. Uro has to do with anything in the urinary tract. Again, vaso means blood vessel. Veno means vein. And one of my favorite root words is xantho. Xantho means yellow, and so if somebody has jaundice in their eyes, yellowing of their eyes, maybe you'll hear that referred to as xanthochromic by loquacious sesquipedalians. All right, so xantho means yellow. All right, before we finish up, I have one more set of slides to excite you with about terminology. And this comes from the Manual for Pharmacy Technicians, the 5th edition. This is what we're using for our Pharm Tech program. And if you've read this book, you can see that a lot of my medical terminology and abbreviations have come from them, even though there's a few things that I still need to change. And we can't even see this from here, but that's okay. I can see it right here. We're going to go through some more common terms defined by body system. I'll make sure that you guys get these notes, and I'll make sure these are more readable on TV. So akinesia, we're talking about terms that are commonly used in the nervous system. Akinesia without movement. Cerebrospinal means from the cerebrum to the spinal cord. Cerebrovascular is the blood vessels going to the brain. Electroencephalogram electroencephalogram is a recording of the electrical activity of the brain. Epi, outside of dura, the hard part of the central nervous system, that outer lining. So epidural is outside of that dural lining, and that'll be a form of anesthesia. Epilepsy, epi, upon lepsy, seizure. Hemi, half paresis, weakness. So hemiparesis is a weakness on one side of the body. I have to look at that. Hydrocephalus, water in the head. Hyperesthesia esthesia means to sense something. Hyper meaning high, excessive sensation. Meningitis is inflammation of the meninges. A myelogram, meningitis is an infection of the meninges. Myelogram is an x-ray of the spinal cord and the nerve roots. Neuralgia is pain that comes from the nerve. A neurologist is one who studies the neurologic system. Paraplegia is paralysis of either both lower extremities. Polyneuritis is inflammation of more than one nerve. Schizophrenia comes from the term the mind is split. This is not multiple personality. This is something that we'll talk about. And paresis means weakness. Plesia means paralysis. And so we'll have to correct this slide for them. Angiography is an examination of the blood vessels using radiology. Anoxia means without oxygen. Arteriogram is an x-ray of the arteries. We do that with dye. Arteriosclerosis is the thickening and hardening of the outer part of the blood vessel. That's different than atherosclerosis, which is the gunky stuff. Brady, slow heart cardia. Bradycardia is slow heart rate. A cardiologist is a physician who specializes in diseases of the heart. Cardiomegaly means enlarged heart. We'll see that with hypertension. Somebody has high blood pressure that's uncontrolled. They'll have cardiomegaly, and if we don't take care of that, they'll have cardiomyopathy, a disease of the heart muscle. Endarterectomy is a surgical removal of the inside of the artery. Sometimes their plaques can be removed surgically. That would be an endarterectomy. Endocardium is that inner lining of the heart. Hypertension is high blood pressure. Hypoxemia, hypoxia is too little oxygen in the blood. Myocarditis is inflammation of the heart muscle. Myocardium is the heart muscle. Pericardium is that lining on the outside of the heart. Tachycardia is a fast heart rate. In the respiratory system, we'll talk about bronchitis, inflammation or infection of the bronchi. Bronchoscopy is taking a scope and looking into the bronchi. Dyspnea is just, here it says difficult, painful, or faulty breathing. Dyspnea is just quite simply the perception of being short of breath. Hypoxia, hypo, low, oxia, oxygen, deficient oxygen levels. Laryngoscope is an instrument for viewing the larynx. Laryngospasm is spasming of those laryngeal muscles. And then pharyngitis is inflammation of the pharynx. Pneumothorax is air in that peritoneal cavity, the pleural cavity, that pleural space. Air gets in that pleural space, and that pneumothorax can not only cause the lung to collapse, but compress. So attention pneumothorax is a life-threatening situation. I have a great lecture on chest tubes in the YouTube channel, and we talk about pneumothorax, intention pneumothorax, and how to use chest tubes. And so that's a great lecture to watch. Pulmonologist is someone who studies the diseases of the lungs. A rhinoplasty is surgical repair of the nose. Rhinorrhea is discharge from the nose. Spirometry is the measurement of breathing. A pulmonary function test is a form of spirometry. Well, you guys know what a stethoscope is, and it's an instrument to listen to the lungs and the heart through the chest wall, and we can use it to listen to the abdomen and everywhere on the body. A thoracotomy is a surgical incision into the chest. Tracheostomy is creating an opening in the trachea to allow an airway, open an airway. And so if somebody has a major facial injury or they're going to be on a ventilator for a long time, we'll do a tracheostomy. Arthralgia is pain in the joints. Arthritis, inflammation of the joints. Arthroscopy is putting a scope into the joint, and so we can see inside of it. And so arthroscopy of the knee is rather common. Brady slow kinesia, movement. We'll see this in Parkinson's disease. Bursitis is an inflammation of the bursa, a fluid-filled sac around the joints. Yeah, that's a perfect explanation. Chondromalacia is a softening of the cartilage. We'll talk about certain disease processes that cause chondromalacia, where their cartilage is just too loose. Again, a cradiotomy is a surgical incision of the skull. An electromyogram is a recording of the electrical activity of a muscle. We'll hear that called EMG. If somebody's having some kind of pain or neuropathy in their arm, we can do an EMG and electromyogram. Intercostal means in between the ribs. The intercostal space is in between the ribs. Intramuscular is between the muscles. Myalgia is muscle pain. Orthopedic refers to straightening the foot. That's literally what the word orthopedic means. But an orthopedist is somebody who not only straightens bones, but is a specialist of skeletal and muscular systems. Osteomyelitis is an infection of the bone. Here it says inflammation of the bone. They like itis to be inflammation, but osteomyelitis is infection of the bone. A palatectomy is the surgical removal of the sesamoid kneecap. Suprapubic means above the pubic bone. Tendinitis, inflammation of the tendons. Adeno, again, means gland. Oma means some kind of neoplasm. So an adenoma is a tumor of the glandular tissue. We'll talk about functional adenomas. If you have a functional adenoma of the thyroid, that just means it's an adenoma making too much thyroid hormone. Adrenomegaly is enlargement of the adrenal gland. Andromorphous means a male form or appearance. Endocrinology is the study of glands that secrete substances into the blood supply to communicate with other organs. Glucogenic, gluco as in glucose, genic, to form in the beginning, anything. We'll talk about neoglucogenesis, gluconeogenesis, starting a glucose molecule from the beginning. Hormones are just any kind of chemical signal inside of the body. Hyperglycemia, too much blood sugar. Hyperthyroidism, too much thyroid hormone. Hypokalemia is low blood potassium. We're going to talk a lot about that with diuretics. Hyposecretion, not to hypo, low secretion. Ketoacidosis is something we'll see in diabetics when they start to form ketones and have metabolic acidosis. Pancreatitis is inflammation or infection of the pancreas. Polydipsia means to be excessively thirsty or to drink too much. Thymoma is a tumor of the thymus. And a thyroidectomy is surgical removal of the thyroid. We'll talk about autoimmune. Those are disorders where the immune system will attack the host, the body. Immunocompromised means the immune system is compromised. Leukemia is a type of cancer of too many white blood cells. We'll go into more detail with that. Lymphadenopathy is the lymph nodes are enlarged, and we want to know whether that's painful or not. Lymphocytopenia means too few lymphocytes. Lymphoma is a type of cancer of the lymphatic system. Macrobigcytosis, macrocytosis is enlarged cells. Metastasis is a spread of cancer from its primary site to another site. Pancytopenia, pan Everything cyto, cell, pinia, too few is another way to say bone marrow suppression. Phagocyte is a cell that consumes bacteria or foreign particles. Septicemia is a bacterial infection of the blood. Splenomegaly, an enlarged spleen. And then a thymectomy is the removal of a thymus gland. Anemia is a blood condition where there's a loss of red blood cells. Hematology is the study of blood. Hemocytoblasts are primitive cells in the bone marrow. Hemolysis is to break down the red blood cells. Hematopoiesis means to form the red blood cells. Leukopenia means too few white blood cells. Again, morphology is the size and shape of specific blood cells. Myeloma is a tumor of the bone marrow. Leukopenia, again, too few white blood cells. Myeloma, we talked about myelocyte as an immature blood cell in the bone marrow. A reticulocyte is an immature red blood cell that has this reticulated or net-like pattern. Thrombophlebitis is an inflammation of a vein due to blood clot formation. In the GI system, we have abdominocentesis, which is a puncture of the abdomen for abdominal fluid. Cholecystectomy is surgical removal of the gallbladder. Cirrhosis is a liver condition causing, colonoscopy is viewing the colon through a scope. Dyspepsia means indigestion. Dysphagia means painful swallowing or eating. Endoscopy means viewing inside of something. And esophagitis is inflammation of the esophagus. Gastroenterologist is a physician who studies the gastrointestinal system. Hematemesis means to vomit blood. Hepatomegaly means enlargement of the liver. Nasogastric means coming from the nose to the stomach. So a nasogastric tube goes through the nose down into the stomach. Pancreatitis, again, is inflammation of the pancreas. Sublingual means underneath the tongue. Bacteria means presence of bacteria in the urine. A cytoscope is an instrument that we use to look inside of the bladder. Glucosuria is glucose in the urine. Hydronephrosis is an enlargement of the kidney due to backup of urine fluid. Ketonuria means ketones in the urine. Lithotripsy means to break stones. Nephrectomy is the surgical removal of a kidney. Nephrosis is some kind of abnormal condition of the kidney. Polyuria means, again, to urinate excessively. Pyelonephritis is inflammation of the renal pelvis. Ureterolithiasis is crushing ureter kidney stones, ureter-based kidney stones. Urethral is pain in the urethra. A urologist is a physician who studies the urinary system. A vesicotomy is an incision into the bladder. Blepharitis is inflammation of the eyelids. Conjunctivitis is pink eye, inflammation of the conjunctiva or an infection. Exophthalmia is the protuberance of the eye. We'll talk about that in Graves' disease. Intraocular means within the eye region. Keratoplasty is the surgical repair of the cornea. Lacrimation is the process of secreting tears. An ophthalmologist is a specialist of the eyes. Optometry means the process of measuring eyes. So an optometrist is someone who measures your eyes for corrective lenses. Photophobia means pain or sensitivity to light. Presbyopia, presby as in slow or old age, opia, means it's really difficult to change focus as you get older. You get stuck in one focal plane, like when you're looking at the phone, and then it's hard to see distance. Retinitis is inflammation or infection, inflammation of the retina. Audiometry is a measurement of hearing. Meningitis is inflammation of the tympanic membrane. An ENT is an otorhinolaryngologist, ear, nose, and throat doctor. Otorhinolaryngologist is an ENT. Otalgia is an earache. Otitis is inflammation or infection of the ear. And otosclerosis is hardening of the bone tissue in the ear. Presbycusis is hearing loss due to old age. Salpingitis is inflammation of the eustachian tube. Tympanometry is the process of measuring the tympanic membrane and its mobility. Tympanoplasty is the surgical repair of the eardrum. Dermatitis is inflammation of the skin. A dermatologist is a specialist who studies skin. Epidermal is outside of the skin, on the skin. Histology is the study of any kind of cells and tissue. If you take a histology class, it's like the anatomy of individual cells. Anatomy on a cellular level. Anatomy under a microscope is histology. Keratosis, again, is a thickening of the epidermis, the outer layer of skin. Onychomycosis is fungal infection of the nails, either toenails or fingernails. Percutaneous means through the skin. Sarcoma is a type of cancer that's going to arise from the fleshy tissues. Subcutaneous, under the skin. Xeroderma, xero as in dry, derma as in skin. In the reproductive system, we have anorchism, a condition in which one or both testes are absent. Aspermia means without sperm. Colposcopy is a type of scope used to look at the vagina. Epididymitis is inflammation or infection of the epididymis. Episiotomy is an incision made in the perineum to facilitate childbirth. A gynecologist is someone who specializes in the reproductive system of women. A hydrocele is a hernia of fluid in the testes or tubes leading from the testes. A hysterectomy is the surgical removal of the uterus. Lactogenic means to produce milk. A mammogram is an x-ray of the breast. Mastodynia is breast pain. Obstetrics refers to the study of delivering babies. Oligo, too few. Spermia means too few sperm. Oophoritis is inflammation of the ovary. Orchiopexy is the treatment of an undescended testicle and placing it. Usually pexy means to tie something down. Prostalgia is pain of the prostate. Vasectomy is the removal of the vas deferens so that the male is sterile. And that is more than enough medical terminology. When I get back, we're going to talk about math. So until then, aloha.